Hi guys, welcome back to my channel. Today we're going to talk about how to kick butt on your internal medicine rotation. So first, let me give you an overview for a typical day in your internal medicine rotation. So normally you come in around 6:30 or 7 a.m. There might be morning report, or if not, you just receive sign out from the night team in the designated area, and then you go to where your team normally works or your team workroom and begin to pre-round on the patients. You're going to pre-round by reading the EMR, then you're going to go see the patient, talk to them, and examine them. And then after that, you go back to your team room and wait for official rounding to start with the attending. Official rounding with the attending can be attending dependent, but normally starts around 9 or 9:30 a.m. You can either do seated rounds in your team workroom where you talk about all the patients first without seeing anybody and then go visit the patients after, or you can do bedside rounds where you go over all the information at the patient's bedside or outside the patient's room and then go in and see each patient after you're done talking about them one by one. Most commonly, I've experienced seated rounds. So you spend the time discussing every single patient that you had from the previous list, then you discuss all of your new patients, and then you go as a team and see every patient together with the attending. Usually rounding ends around 12 p.m. and then there's often noon conference, which is usually an educational lecture that happens between 12 and 1, and it's also time for residents to have lunch. After that is the afternoon, so you start to do your afternoon work, finishing up any notes, or the residents at least will be finishing up any notes that they're writing. And sign out usually happens around 4:30 or 5 p.m. unless you're on call, and then it depends on the program. So now let's talk about what you can do to do well and get those great evals on your internal medicine rotation. One great thing that you can do to get those good evals are to do medical reconciliations for the residents. So what's a med rec? A med rec is when you call the pharmacy of the patient and you get down all the current medications that the patient is taking. This is definitely super important because it's needed for discharge of the patient, and it's also important for the patient's course if they have a lot of comorbidities. So definitely want to get those med recs done. Another thing you can do is talk to family. If you know the case really well or you've been following this patient, you're probably going to have the most time to spend with their family member, with your patient. So it's best if you go in there and you give the family updates on what's going on. Another really helpful thing, especially if you live in a diverse area, such as I do in New York City, is if you speak another language, use that, because there's so many patients and some of them don't speak English and they still need your care and they still need a good quality of care. So if you can speak any language and help translate, make that interaction with the doctors go more smoothly, the residents will really appreciate you for that and they'll remember you for that too. Another great way to get good evals is to kill those presentations during the seated rounds that we were talking about. So during that time, you're going to have the attending listening to you and the residents are going to be listening to you. So you want to make sure that your presentation is nice and organized and concise with all that pertinent, positive, and negative information. But you also want to make sure that you're thorough and have the answer to any questions that the attending might ask of you. Another thing that you can do is to practice writing your notes. So sometimes in your rotation, you'll be required to write maybe a note a day, but if you're covering more than one patient, then it might be a great idea to practice writing multiple notes, even if it's just in a Word document or in your email without any patient identifying information, so that you can later send it to the residents, and then the residents can go over the note that you've written. Maybe they'll give you some feedback or you can ask for it, which is also great. And they might be able to even utilize the information from your note when they're writing their note, which is helpful because it expedites the process of them writing all the notes for the patients that they have to cover. Another great way to get evals is to make sure you know your physical exam. So during your third-year rotation, you're probably going to be the only medical student on your team, and you might get pimped. Pimping is when the attending or the residents ask you questions just out of the blue and you're expected to answer it, and you might be at the patient's bedside when you have to answer those questions, or you might be in front of other residents or other medical students when you have to answer those questions, and you really want to be able to have an answer. It's okay to say I don't know, but more often than not you want to try and have an answer. And another form of pimping is they might ask you to do a physical exam on the patient in front of the entire team. So now you have the entire team watching you, the attending is watching you, and the patient is watching you, because the patient is like, do you know what you're doing or not? So make sure that you practice your physical examination skills watch some YouTube videos about how to do a proper physical exam on a patient in internal medicine. And when you do your physical exam, do a thorough physical exam. That's what the attending is going to be watching for. A thorough head-to-toe physical exam where you check out the patient's body as much as possible on the skin, not over the gown or over the blankets, and comment on the findings that you can see. So the last thing that I'm going to recommend for you to get a really great evaluation in your internal medicine rotation is to go above and beyond for your patients when you get an opportunity to. So on your internal medicine rotation, the most patients that you're probably going to be taking care of at one time is 4 patients. And those patients are yours. You need to know everything about them. You get to spend as much time as you can with them because this is the time that you have the most time of your day to spend with a patient. And things to go above and beyond for your patient are transporting them places that they need to go, like to get specific tests and examinations done. The hospital may have some transportation staff, but especially in an emergency, if you're there and you're willing to bring that patient up to CT scan, or you're willing to run and grab something for the team when they need it most, that is going above and beyond for your patient, and that will be recognized. Bringing the patient things that they might need or might be asking for that the doctor is not going to take the time out of the day to go and get, such as heating up their food or giving them an extra blanket or something like that. The hospital is a busy but sometimes uncomfortable place for the patients, and they ask for as many things to make themselves more comfortable, but sometimes they don't get what they need because the staff that they're asking is very busy taking care of all the other patients too. So if you can take a little second out of your day to run and make a patient's stay more comfortable, that's a great way to go above and beyond for your patient. And it's something that will follow you over time because you may be asked in the future to give examples of how you went above and beyond for a patient. And as a medical student wanting to care for people and become a doctor, you should have some examples of how you went above and beyond. So now let's talk about how to prepare for the shelf exam. So at the end of your rotation, now it's time to take a test, summarize everything that you've learned, and move on to the next step. So the first thing I'm going to recommend is to do UWorld practice questions. This is your holy grail, okay? You want to do a few UWorld questions every day, and I would start from the beginning if you can. If you want to give yourself a day or two to kind of get into the rhythm of a new rotation, fine, but really don't slack on this. You need to do at least like 5 to 10 questions a day at the beginning of your rotation. Even if you don't know anything, just do them, see that information. You're going to want to increase the number of practice questions that you do as you get closer to the shelf exam, and maybe graduate to doing full 40 question practice tests on the way to actually being close to that exam. The UWorld Medicine section has so many questions, like over 1,000 questions, and it's not really possible to get through all of those questions in the 8 weeks of your internal medicine rotation because you're working pretty long hours. When you come home, you might be tired and you may have other responsibilities. So just try your best to get through as many questions as you can, and don't beat yourself up if you can't get through all of them. Medicine is a foundation for all other medical specialties, and you will need to revisit medicine practice questions throughout your other rotations. So if you don't finish all of the questions by the end of your IM rotation, just go ahead and try to add some into your, question bank or your practice question rotation as you go into the other specialties. Try to get through all of them by the end of your 3rd year. So this has 2 benefits. One is that you'll have seen all of the medicine questions by the time you have to start preparing for step 2 after 3rd year. And you don't have to worry about, there's still some questions left over that I haven't yet done and I haven't seen this material in months. No, you keep going with that spaced repetition. Speaking of spaced repetition, Anki is another really great resource for spaced repetition. It's something that you can do easily on your phone, and you can just pull up some flashcards when you're commuting to and from the hospital to just keep bringing back that information. There's so many topics within internal medicine itself that you might be studying the GI system one day and doing practice questions related to GI one day, but you still don't want to forget that cardiology information that you have to know too. There are some passive learning resources that have some pros, and they also have some cons. So one of those would be online med-ed. I used online med-ed for a little bit during my internal medicine rotation to kind of bring me back to speed about, brief overviews of all the topics in medicine. And it was a really good resource for those videos and just to relax and have someone reteach me this information. The problem with that is that it's a very passive learning resource. Taking notes on a video or taking notes on reading is not going to help that information stick in your head because it's not challenging your brain to remember information from your own self. It's giving you information that you're trying to absorb, but it's not easy to absorb everything. So you need to really be challenging yourself by giving yourself more practice questions rather than watching videos. Therefore, I don't really recommend watching a ton of online med-ed videos or reading cases or books because these are really passive ways of learning. Research has shown time and time again that the students who perform the best are the ones who do the most practice questions. So questions, questions, questions is your way to go. And finally, I just want to say that the internal medicine rotation is a pretty intense rotation. Like I said already, you're spending a lot of hours in the hospital and it's something kind of new to experience. So you may not find yourself having as much time to do those things that you love to do, such as going to the gym or cooking, and that can be really hard to balance with your mental health. Just remember, this is only 8 weeks of your life. It's a really short time period in the grand scheme of things. And if you don't fully master how to balance all the aspects of working, studying, and then also living life in those 8 weeks, it's okay. Just be kind to yourself, relax, take a deep breath, and take it one day at a time. Once you're done with that shelf exam, put it behind you and on to the next rotation. All right? Thanks, guys. I hope this was helpful. Any other questions, please leave it in the comments below, and I'll see you in the next video. Bye!